What's up, beautiful people? Hope you're doing okay, and welcome back to my YouTube channel. It's me again, your girl clinician Celine. And if you have not subscribed, please hit that subscription button and join this family. If you're a returning subscriber, thank you so much for being among this family. And comment, like, and share this video so that everyone can benefit from this knowledge. Okay, so today I'm back with an interesting topic, and I'm going to talk about fibroid. And I know so many people outside there are suffering from this, and maybe they end up going to the hospital when it is late. My dear sister, my dear mother, my dear aunt, wherever you are, please, let's pass this information to the right person and help them get help. Okay, so fibroid, or you can call it leiomyoma or fibromyoma. Okay, I'm talking about benign tumor of uterine smooth muscle. Okay, it's common between the age of 25 to 40. Common. When I say common, mostly affect that age bracket, but it does not mean if you are below 25 you can get it, and if you are above 40 you can get it. Okay, hope I'm clear about that. So this has been something that it has touched me, because one of my client, after referring her, he was confirmed having fibroid. Okay, so I thought, why should I not share this information so that you can also get help when you are suffering about this. Sorry. So what are the things that suggest you're having fibroid or leiomyoma or fibromyoma? What are these signs and symptoms that when you see, they're just alarming, like, sister, go checked, visit the hospital, visit your doctor, contact your doctor? Yeah. One is menorrhagia. Menorrhagia is overflowing of your menstrual period. Okay, your menses or your period is regular, but when it is due time, you tend to overflow. Inakuja mingi, nanyesha mob sana. Like you can change even full pack of pad in a day. That is dangerous. Okay. Number two is metrorrhagia. Metrorrhagia is abnormal bleeding in between your regular period. Okay, hope I'm clear about that. Number three, we have urine retention or frequent urination. Okay, then number four, some people experience back pain. Okay, or lower abdominal pain. Okay, some start complaining or reporting when they are just having flank pain. Okay, hapa karibu na, let me say, karibu na ovaries ama ndio fallopian tube. Let me say something like that. I guess stand here. I'm talking about this flank pain. So some may start complaining about that or report about having some flank pain. Okay, and another one, you are just having PV bleeding. It may not be menorrhagia, that it's let me say PV bleeding or abnormal bleeding. Okay, nilikuwa number 5. Yeah, number 6, you may have pelvic mass swelling. Unaona, ukishika hapa kwa pelvic una feel like there is something inside. There is something growing. Okay. Another point, number 8. Excuse. Number 8, you may have dyspareunia. Dyspareunia is painful during sexual intercourse. Okay, una feel uchungu until you may hate having sexual intercourse. Okay, another point you may have, I've talked about back pain, I guess so. Yeah, some tend to have so these are the signs that are suggesting you are having. Okay, hope I'm clear on signs and symptoms or things when you see, you start feeling them. Please get checked. So what are these risk factors? What are things that may lead you to have this? One is family history. If maybe you are having a family history of fibroid in your family, you know, some things are genetically inherited, so you may want having that. Number 2 is nulliparity. Nulliparity is like you have in your age group between, let me say, 25 and 40, because commonly occur in that age bracket, and you have not given birth yet, so it's a risk factor. Those are things that contribute to fibroid or growth of fibroid. Okay, that's number 2. Number 3 is long use of contraceptive. However, how much you want to use contraceptive to prevent pregnancy or to plan for your pregnancy, but when you use it for long, remember, everything has side effect. Everything has its advantage and disadvantage. So it's you to outweigh which one outweigh the other. Okay, so that you can benefit from this. Another thing is long spacing between pregnancy. That's number 5. Like, I remember, like, my last client who visited me with just a complaint of low abdominal pain. Then after giving some medication, the pain went away, then it recurred. So I suggested that she get an abdominal pelvic ultrasound, which it later turned out that she was having fibroid. The last born akona 8 years and anamtoto. Unaona, it's the long spacing in between your pregnancy that is a risk factor. Okay, hope you are getting this. So another thing, number 7, is high diet in red meat and low veggies. You see the effect of eating a lot of red meat. Nyama mingi si mzuri. You need to balance and eat a lot of veggies because it's healthy. Okay, and another risk is number 7 or number 8 is women who are overweight. That's why I started by talking about the importance of exercise. Okay, the risk of overweight. If you have not watched that video, please kindly watch it after this one and get informed. Okay, so those are risk factor. Another one is early menarche. Menarche is like the first time you are having menstrual period. If you tend to have it early, you see some start at 9, 10, 11, 12. The earliest is 9 that I've ever had. Some tend to have, for myself, I started when I was 14. I was 14 actually. Hey, and it was stressful, and my mom used to ask me every day, kwani ujaona kitu fulani, then ujaona kitu fulani. So when it happened, I noticed what ndio nilijua ni nini alikuwa anaongelea. Okay, so those are the risk factors, and how you can, the best investigation to have is abdomen pelvic ultrasound. That's the best and the easiest. It doesn't have any effect, or you can say those rays or what. No, this one is healthy. Okay, another one, they can do laparoscopy, but I just know the best and the commonly used is abdominopelvic ultrasound. Okay, and fibroid is treatable if you go to the hospital early. If you get checked very early, it's treatable. Okay, some stages or early stages fibroid is treated by medical, and if you delay, it is surgical. Okay, and it depends with the size of fibroids. Okay, hope I'm clear. And some of the complication, number one is infertility. Infertility is very bad. Ask those moms that are wishing to have a baby or bear any child. Ask them, it's not good. Another point, number two complication is that you may tend having some miscarriage or abortion when you get pregnant. Another one, it might complicate to malignant cancer. Okay, cancer of the uterus. Okay, later it might spread to other parts of the body and you may end up losing you. That's not good. And another complication is infection, because when you have these malignants, they lower your immunity. Okay, another number 5 complication is anemia, because you are bleeding a lot and you may tend up to lose a lot of blood, then you end up having anemia. Okay, hope you are clear on those complications. Okay, so that has been all about this fibroid. And you know, when my client approached me and he told me that thank you for referring me to I referred her to county hospital where there is all the required instrument to do ultrasound. So after that, the gyna recommended medication, and after 2 months the client returned akaniambia ako sawa. He went back for the second checkup and he did abdominal pelvic ultrasound and it came out good. So please, this was touching. If I've ignored and just given some pain reliever or some antibiotic that eases the pain, it has been, maybe it could have the fibroid sai ingekuwa inaendelea kwa size, then later it complicate. You see, that's the best of it when you get early checkup. Okay, bye, let's meet in the next video. And if you have not subscribed, please hit that subscription button. And if you're a channel subscriber, thank you. Like this video, comment and share.